Welcome to the deep dive. Imagine trying to make sure your voice is heard in healthcare, especially when, big decisions come up. But what if your culture, your language, your deepest beliefs aren't fully understood?
Yeah, that's a huge challenge.
That's what we're tackling today with Advanced Care Planning, or ACP. It's all about making your future healthcare wishes known. Really important stuff.
Absolutely vital. And when people actually do engage with ACP, the results are pretty clear. We see better quality of care, fewer hospital trips.
Less stress, too, right, for everyone involved.
Exactly. Less stress for patients, for their families, their support people. It really comes down to extending your own autonomy, keeping control.
Okay, so it seems obvious then, just translate the forms, the resources, right, into different languages.
You think so? But here's where it gets really interesting and, well, complicated. Direct translation. It often misses the mark entirely. Sometimes it can even be a barrier itself.
A barrier. How so?
Because it's not just about words. It's the whole cultural context.
Right.
Beliefs about death, about decision-making, about family roles, they shape everything.
So give us an example.
Well, for instance, in some cultures, directly talking about death is seen as almost like inviting it,
Uh-huh.
or maybe competing with God's plan. It's a deeply held belief, not just a preference.
Oh, okay.
And then there's the whole question of who makes the decision. Is it the individual, like often assumed in Western medicine, or is it the family unit? Or maybe community elders hold that responsibility. Big differences there.
And I guess the data backs this up.
It does. There was a large audit study, pretty significant, that found people born outside Australia were less likely to have completed advanced care directives. We're talking about 21.9% versus 28.9% for Australian-born individuals.
And it's not just about, like, needing an interpreter.
That's part of it, definitely. Limited English skills, not enough professional interpreters, or maybe using family members, which can be really problematic. It all leads to poor quality discussions, but it goes deeper.
Deeper how?
It points to needing resources that are culturally appropriate, not just translated. Resources that actually resonate with different worldviews and values.
Right. So how do we actually bridge that gap? It sounds like a huge task.
It is. And that brings us to something really positive, the I Can Care Plan project. It's a 3-year initiative specifically focused on improving ACP for people from CLD backgrounds who have cancer.
I Can Care Plan. Okay. What are they doing?
They're really digging into it. First, understanding the current situation, what's happening now. Then looking at existing resources. What's out there? Is it any good? Identifying the barriers, the things that get in the way.
And the facilitators, too, I imagine. What helped?
Exactly, what helps things along. And then, this is the crucial part, they're co-designing solutions.
Co-designing. That sounds key. What does that actually look like in practice for, for the listener, for the future of healthcare?
It means moving beyond just asking for feedback. It's about genuine partnership. They're bringing consumers from CLD backgrounds, clinicians, researchers together right from the start.
So not just designing for them, but with them.
Precisely. And they're really careful about it. They use consumer co-facilitators, professional interpreters, bilingual field workers, all to try and balance out those power dynamics, Make sure everyone's voice can actually be heard on what is, let's face it, a really sensitive topic.
Yeah, talking about end-of-life wishes is never easy.
No. They even have things like distress management plans in place because these conversations can be tough. But the insights you get from genuine co-design are incredible. Things you'd just never guess otherwise.
Like what? Any examples?
Well, in one community group they worked with, the initial thought was maybe they needed better written forms in their language. Makes sense, right?
Sure.
But through the co-design process, talking with the community, they discovered the real need wasn't the forms. It was actually about empowering trusted community elders to help facilitate family conversations. Because for them, individual decision-making wasn't the primary model. Family consensus was.
Wow. So the forms were kind of irrelevant until that family discussion happened, led by the right person.
Exactly. You build the bridge with the people who need to cross it. It changes everything.
So this project, I Can Care Plan, it's offering some really novel evidence, isn't it? And practical strategies, too.
Definitely. It's pushing us beyond that sort of one-size-fits-all mindset for ACP.
Yeah.
We need approaches that are truly person-centered, especially with Australia's growing diversity.
It really underscores that effective healthcare has to understand and adapt, doesn't it, to the individual's unique cultural background.
Absolutely. It's about respect, cultural humility, understanding that your way isn't the only way or even the right way for everyone.
So wrapping this up, what's the big takeaway for you, our listener?
I think it's about reflection.
Yeah, maybe take a moment to consider your own background. How might your culture, your upbringing, your beliefs subtly, or maybe not so subtly, shape how you think about future health decisions.
And importantly, what steps could you take or encourage your loved ones to take to make sure those unique preferences are truly understood and respected by the healthcare system, no matter where you come from?
That's definitely something powerful to think about. Thanks for joining us on this deep dive. We'll catch you next time.